Welcome to The Critical Path, Greater Vancouver REALTORS professionalism and innovation-focused podcast. I'm your host, Mark Moldowan, filling in for Jesse Lalime. Each episode, we sit down with industry leaders and partners to talk about the issues that shape our profession and the paths we can take to build stronger, more sustainable careers. For many realtors, real estate is more than a job. It's a business, a lifestyle, and often a 7 days a week commitment. That kind of pace can be rewarding, but it can also make it hard to prioritize something that underpins everything else we do, our health. Accessing timely, coordinated healthcare can be challenging, especially for self-employed professionals who don't have traditional workplace benefits. That's where our latest partnership comes in. Advica Health, in partnership with your association, is now offering GVR members access to a discounted health navigation and wellness program designed for busy professionals. And today, on The Critical Path, we're joined with Kevin Brady, founder of Advica Health, to discuss this new plan and how it can benefit you. Kevin, welcome to The Critical Path.
Thank you, Mark. Good to be here.
Great. Well, to start us off, can you tell us and our listeners a little bit about your professional background and what led you into the healthcare and wellness space?
Yeah, great question. So my background is employee benefits. So first of all, on the corporate side of things, where I kind of went through the executive ranks with one of Canada's largest insurance companies. And then I went out and started my own employee benefits consulting company. So we would go into companies and help them arrange their benefits, their health, dental, pension plans for their companies. And it was through that work that I realized that there was an issue because often presidents, CEOs, executives, when they had health issues, they would reach out to me. And I would help them through my connections, get them through the system. I would, through connections, let's say at MedCan or Cleveland Clinic or Mayo. And it kept happening over and over again. And finally, I thought there's got to be somebody doing health navigation in Canada. So I actually went and did a request for proposals, went across Canada for a health navigation service because I thought this would be a great service for my benefits customers. And lo and behold, there was nobody doing health navigation. So I went out, I hired a nurse, and I said, just as a value-added service to my benefits customers, I said, I just want you to look after our clients when they have a health issue. And lo and behold, she became so busy because that's when the light went on for me. I realized how backlogged our system is, right? And she became so busy. Eventually, I had to go and hire another person to look after our customers. And so that actually was kind of the start of Advica Health as we know it today.
That's interesting. So a little bit of disclosure for our listeners. We do a little bit of prep work before we come in, and I understand that there was actually like a specific moment that really pushed you to found Advica Health. Can you talk about that a little bit?
Yeah, you're probably referring to my my health crisis, right?
Yes.
Yeah. So, and I actually have had a few of them, but the first one was I was actually quite active, and I thought I was healthy. I was actually running a marathon. It was my 5th marathon, and I actually after the marathon was not feeling well, and I went to the medical tent, and the medical director took my blood pressure, took my heart rate, and he said, "Kev, you just finished a marathon." He said, go home. And typically you recover, for the listeners that do cardiovascular sports, typically after an event like that, within 5 minutes, you're back feeling well again. And I wasn't. I was actually going the other way. And to the point, my wife actually even backed up our SUV for me to get in it. And I wouldn't get in it. I said, no, I'm not feeling well. I'm going to stay here. And she took our other 2 kids off to a recital that one of our other kids had on. Anyways, eventually I was just feeling so poorly. I mustered up all my strength and went back to the medical tent. And I just said, I need an ambulance. And the last thing actually I remember was being carried arm in arm from the paramedics into the ambulance. And then I obviously passed out. My wife had left her 8-year-old with me. So we actually, both of us were in the ambulance being rushed to the hospital. And reading the medical reports, it took 11 doctors and nurses to tie me down because I was convulsing so badly. And they did all the testing on me. They sedated me, and they knew I was in tough shape. So they actually shipped me to another specialty hospital. And I ended up in a coma for a week. I was on full life support. I had machines actually keeping me alive. I had a ventilator, respirator that were basically keeping me alive. And I wasn't coming out of the coma. So the race was on a Sunday. About the Wednesday, they called my wife in, Barb, and they said, you better get your affairs in order because Kevin has less than a 10% chance of living here. Well, fortunately, I am here today, so I did come out of my coma. That's the good news, and it was a long recovery. But that's when kind of the light went on for me through that recovery and through trying to navigate the system on my own. Just how critical it is to have health supports in place. And actually, because I'm in the health business, I do a lot of preventative testing. And if when I look back, if I had done some of that preventative testing prior to my marathon, that near-death experience likely wouldn't have happened.
That's wild. And I'm sure that has painted some of the ways you're running Advica and some of the initiatives that you've added to the program, right?
Yeah, everything. Yeah, because you know what? People need help especially in a situation like that in time of crisis. But people also just need help getting prescriptions or just being even simplest thing, just being diagnosed with things, right? So, the whole healthcare journey, as I always say, every day we wake up, we kiss our kids, kiss our wife, goodbye for the day, and we have our to-do list, and everything is great until you have a health issue, right? And I don't know if you've ever had one, Mark, but you or your kids or your family or your mom or your dad, but most of us have. And all of a sudden that becomes your number one priority, right? It's like everything else goes out the window, right? It's like that is all that matters right now.
Yeah, absolutely. I've experienced it myself and my family as well has experienced it. So I definitely understand what you mean by health navigation and how that is beneficial because the system can be very difficult to navigate. But for our members who might not be familiar with the concept, how would you explain health navigation and why it would benefit them?
Yeah, that's an interesting question because it's a new service. In fact, we're the only ones in Canada that's offering this type of service. But so navigation, the best way I can explain navigation is it's anything you need from a health standpoint. Like it could be as simple as I need a prescription, I need a refill. It could be my son or daughter has a fever, it's 3 a.m. and I don't know who to go to. It could be I've just been diagnosed with, God forbid, cancer, and I need to find who the best in the world is for treatment options. And it could also be preventative testing. Like, am I doing all the testing that I should be doing to know that I don't have a health issue, right? And it's kind of everything in between. So the best way I describe navigation is someone putting their arm around you, which in our case is nurses or medical team, putting their arm around you and helping guide you through the system. And, often I'm asked, how'd you come up with the name Advica Health? Well, we're advocates for your health, right? And especially in time of a health issue, that's when you really need an advocate, and some people some of our customers refer to our program as, they refer to it as having a doctor in your family. And I remember the first time I heard that, I asked the person, I said, what do you mean by that? And they said, if you have a doctor in your family and you have a health issue, they're calling their friends, they're calling their doctor buddies, basically they're getting you through the system. And that's really what navigation is. It's somebody guiding you and being your advocate and at your side and helping guide you through the system for, as I say, as small as I just need a prescription to I've just been diagnosed with something serious.
That definitely seems useful. It covers a lot of gaps that you can see there in our health system. Now, kind of want to think about some of our members. They're self-employed, and like I said before, it's not a 5-day 9-to-5 job, right? It's 7 days a week, and a lot of our members struggle with stress and inconsistent access to care. And what do you see are the biggest challenges that realtors and other self-employed workers may face?
Yeah, I think there's a few things. One of them is who do I go to when me or my family have a health issue, right? Like, who do I go to? Some of your members may have, a benefits plan that covers treatment, but I always say you got to get to that treatment, right? So, and that's really the differentiator between what we do and employee benefits. Or benefits is benefits pay for a lot of these services, but if you got to wait, 9 months to see a specialist, you're in trouble, right? I just came from another meeting where a vice president shared that her husband was on, I think it was over 6-month wait for an MRI, and used our service, and was very fortunate. We got them in 3 days, right, through the public system. Now, we don't guarantee that. There was obviously a cancellation or something that came about. But, it's I think the biggest challenge is if you have a health issue, you think when you've had them, or any of your listeners, it's always like, what do I do here? Who do I see? Where do I get help for me or my kids? How do I do that? And to have someone simple, like, on speed dial, basically, that they can plug into our system and have an advocate that's putting their arm around them and helping guide them through the system, is worth its weight in gold. And I'll just share a story because it's a recent story. Often when people have health issues, one of our members will refer them to our program. So often, a week doesn't go by that I don't get calls about certain things. So I just had one last week, and it was actually a female executive in Vancouver, and she was just diagnosed with quite serious cancer, like stage 3 cancer. And so I picked up the phone, and she said, "Oh, I was referred to you," and she was and understandably, she was beside herself with the stress. She says, "Oh, I'm Googling this, and I'm going to the Mayo. I've seen this on the Mayo Clinic, and I'm seeing this on Harvard," and just you could tell she was in a frenzy. And I just said, "Take a deep breath." I said, "We've got you." And she said, "What do you mean?" And I said, "We know who to go to, who the best is, not just the best in the province in BC, the best in Canada, the best in the world. And we will have you talking to that person tomorrow." And you could just feel like just the stress was gone from her. So it was like, she said, "Really? You can do that?" And I said, that's what we do, right? That's our program. Right.
When you have a health issue, it can be like a full-time job sometimes to figure that stuff out. So yeah, I can definitely see how that would be really helpful, especially with something like that. That would require a lot of follow-up and like you said, finding the right person.
Right person. And the other I guess feedback we hear often prior to people joining our program is there's often disconnects, right? You go to one doctor, you hear one thing, you go to another specialist, then you go for another treatment. And often there's nobody coordinating all those different things, right? It's like you're starting over again each time you go to a doctor or a specialist. Whereas with our program, through somebody advocating for you and having all your records on file, we make your life easy. You show up to the specialist appointment, we've already sent over the records. We've already apprised the doc on what's going on. So they already know, they're already aware of what your condition is before you even show up.
Yeah, that's great. So we're talking about some of the kind of overview of what this program does, but let's talk about what's available to GVR members and what's included. So we're offering, it's the Advica Health Gold Plan.
Yes,
that's correct.
Which is our premium plan. Yep.
Yep. And so what specifically can they access in there?
Yeah, so there's a bunch. This could be a long answer, but there's a lot of things. So please interrupt if you have any questions. But one of the first thing is just 24/7 access to a doctor, right? So part of our program is we use a service that's 24 hours a day, 7 days a week, 365 days, where you can hit a button on your phone and you're talking to a doctor live within a minute or two. And the service we use is actually the reason we chose them is it's 24/7, it's unlimited, and you talk to the doctor or the NP, right? So somebody that can actually diagnose and write your prescriptions, right? Because we found a lot of the services out there that we were looking at for our members where you'd go to a call center and then you'd be kind of referred over and maybe a day later you get what you need. Whereas we have the person that can actually write the prescription will be picking up the phone or picking up the app, right? So, yeah, so that's kind of the start of the program. And then the second part is the navigation, which is a big part, which is virtual health is great, but it only solves about 30% of the cases out there. Unless it's black and white, then you're pushed back to the system again, right? Unless it's like, oh yeah, I know the doctor says, yeah, I know it's an earache, or I know it's a rash, or I know it's an infection and that type of thing. Then they're advising you to go back to the medical system, and then you're stuck again, right? You're going to a merge, or you're going to a walk-in clinic. And that's really where our program takes over, and the navigation and whatever you need. You need to see specialists, you need an MRI, you need a CT scan, you need blood testing. Whatever's needed, we're going to help arrange that and get it for the member and get them through the system.
Right. So I want to go back to something you had mentioned previously when you were talking about your own personal journey through the healthcare system, and that was preventative care. And I understand that you offer some preventative care options through the program. Can you talk about those a little bit more?
Yeah, great question. I mean, so I'll just back up a bit and say we really have two types of members, right? So, one type of our member is someone that joins our program, and they refer to us as the parachute. The parachute meaning I have a health issue, my family has a health issue, I'm going to pull the parachute, like reach out to Advica Health, and I know they're going to help me. But we also have a lot of other members that they join us for the parachute effect, but they also want to do preventative testing. And there's so much preventative testing that's available today that, unfortunately, most of us don't even know even exists. And I call it knowing your score, right? Like most of your realtors would drive a car, I would think. And, we when the service light comes on, I just actually had my car service. I just picked it up yesterday. The service light comes on, then we take it to the dealership and they hook up the electrodes and they say, yeah, you need a new air filter, you need a new carburetor, you need new brakes, whatever you need. But often we don't do that with our own bodies, right? We wait. It's almost like we wait for something to happen. And I'll say no disrespect to us as the consumer. It's just the way we're almost taught is that, you wait for something to happen and then you fix it. And it really breaks my heart because every week we get calls from people that have had a heart attack, that are diagnosed with cancer. And a lot of these things can be prevented. The key is getting this stuff early, right? Getting this stuff early. Like we're doing things now. We're doing like full body MRIs for our members, for example, that will show a little shadow on somebody's lung or a little shadow on their kidney. And it's stage 1 cancer instead of getting it in stage 4, right? And I'll just share a story on that. I had it was a president of a company, female in Vancouver, that last fall called me, and she said, and she had heard me speak because I go out and talk about all this testing and stuff. And she said, Kevin, she called me randomly. I was at my cottage, and she said, I don't know if you remember me, but you spoke to my president and CO group like 6 months ago. She said, I joined your program, and then I've been doing all the testing that you recommended. And she said, I'm calling you to tell you that you saved my life. And I said, explain that to me. She said, I've been doing the testing that you had recommended, and one of those tests was a full body MRI. She actually went right here in Vancouver to Prenuvo, which is one of our partners. She said, I went for my full body MRI, and a shadow showed up on my lung. So through your program, I was able to see a lung specialist right away. And she said, I just came from the specialist. And she said, the bad news is I have cancer. She said, but the good news is it's stage 1. And the specialist asked me, he said, why did you go for this full body MRI? Like very few people do this. And she said, oh, I heard this guy, Kevin Brady, talk, and he talked about all this advanced testing. So I've been just going through all the different testing. And the doctor said, you should call him and tell him that he saved your life. And she said, so I'm calling you to tell you that you saved my life, because this cancer, the specialist said it was super fast growing cancer. And 6 months from now, she would have been not feeling well, and it would have been like stage 4, right? Wow. So, and we get those stories all the time, right? So, and while we're on the discussion of cancer, I mean, we're one of the few companies in Canada that can arrange for blood testing for cancer, which I've had it done myself. It's kind of scary. The nurse comes to your house, does a blood test, but it shows if you have cancer cells circulating in your body. which most people don't even know that test exists. So when it comes to health, when it comes to testing, and I always say you don't know what you don't know. It's our job to be in the know. Like, not just be in the know when you have a health issue, but be in the know for advanced testing as well, right? So for people that want to go down that rabbit hole, whether it's cancer, whether it's heart testing, whether it's dementia, whatever, metabolic, like diabetes, those types of things, there's testing out there. So we do a lot of that for our members. We arrange where to go and how to get that testing done.
Great. Yeah, because prevention and finding things early is just so key in a lot of those situations. Now, we talked a lot about physical health, but there's also a mental health aspect to your program. And I know that that's one that comes up a lot for members. As I mentioned before, they're under a lot of stress. They're usually quite busy. And mental health can be one of those things that can creep up on you and really affect you, especially when you're a self-employed person. It can really, affect not just your professional life, but your personal life as well. So what mental health programs are available through here?
Yeah, great question. Through our program, there is full mental health support. And it's interesting because every week we have a team meeting with all our medical team across Canada. And we look at how our services are being used. And mental health, pretty much every week, is our most used service, which on one hand is scary because you're going, okay, that's a indication of what's going on right now in today's world. But on the other hand, the good news is we have a solution for it. So our solution for mental health, and it's the same thing. Benefits plans are traditionally pay for, to see mental health specialists. But if you got to wait a year to get there, it's a problem, right? So we created a program. Actually, we created it for BC nurses, the nurses in British Columbia, about 2 years ago. We created a program for them called Mental Health on Demand. And what does that mean? It means just what you think what it sounds like is, I have a mental health issue. I need to talk to somebody. It could be 3 a.m. It could be middle of the night. It could be Christmas Eve, or it could be my son or my daughter. You can hit a button on you're talking live to a mental health professional. We call it master's level clinician, which is a certain designation. And so that, in itself, that is a very, very useful service. And then from that, then people often want, or through discussion with our nurse navigation team, we will arrange for ongoing therapy. And again, we have access to therapists right across Canada. With our program, you choose your therapist. And we also get a discounted rate of $90 an hour for therapy. And I don't know, Mark, if you know the price of therapy, but it's usually about $200, $250, right?
Yeah, that's when you said the $90, I was thinking, that's pretty good price. That's pretty good.
Yeah, so your dollars go a lot further as well. And you pick your therapist, right? So a lot of these programs, they tell you who your therapist is. Through our program, you pick your therapist. So bottom line is we've got all the mental health supports that are needed for your members, their families, and again, having access to that helpline when they need it.
So that brings me to my next question around preferred pricing, because that's a key thing in this partnership. You mentioned the pricing for therapy. Which again, $90 an hour is pretty good. If anyone else out there has ever had to go to a therapist, it can be quite expensive. What other preferred pricing programs do you have?
Yeah, so what's interesting is because we have so many members across Canada, and then we are then linking our members with the best health solution. Often a lot of these third-party providers, whether they be executive health clinics or imaging or whatever, lots of times they want to pay us to send members their way. And we never want to be swayed by being paid for arranging those types of services. So we usually flip it and we go back to them and say, no, we don't want to earn any commission, but we want you to discount the rate that our members would pay. So we try to do that in every situation. We don't do it in all cases, but fairly typical. If you go for an executive medical, let's say we're a comprehensive medical, generally we're getting a discounted rate. And depending on where you go, it can be up to $1,000 discount. So it can be quite substantial as well. So, what I always say to people is, the real value of our program is knowing who to go to, and that's our expertise, right? Getting you there efficiently, and then paying no more than you would pay ever on your own, right? So where we can, we negotiate discounts.
So the next question I have is something that's a little dear to me because I have family in this situation. A lot of my family are dual citizens, but a lot aren't, and do spend a lot of time though across the border. So I understand when I was looking at your program that you have some U.S. navigation and like travel help as well. Can you talk about that a little bit more?
Yeah, so a lot of our members they either travel to the U.S. on holidays or vacation, or a lot of our members actually have U.S. properties, down in Palm Springs, Palm Desert, Hawaii, whatever. So we have a U.S. partner that does exactly what we do in Canada. So you're down in wherever, let's say Naples, and you have a fever or you don't know where to go. Again, we have a U.S. partner that as long as you have your phone with you, then you can access to find out where you should go for care, where the best place is to get a prescription, how to get a prescription, or anything else you might need. I mean, a lot of our members, because they spend so much time in the U.S., we even do, we arrange if they need it, let's say knee surgeries or hip surgeries or that type of thing as well while they're down there. So as long as a person has their phone with them, our U.S. partner looks after our Canadian members while they're traveling in the U.S. and their families. And I mean, I don't know if you've ever experienced it. I know I did myself one time with my wife. We were on vacation and needed to go to the hospital. And first of all, you don't even know what hospital to go to. And then you just show up, right? And all of a sudden, like it's $1,000 to even check in type of thing, right? And it just goes on and on. And, if you've been through that, they're charging you for the Kleenex you use, the Q-tip, the whatever, every little thing. And it's just, you really we think we need an advocate in Canada. You for sure need an advocate when you're down in the U.S. And we've got a daughter that lives down in the U.S. and she works down in the U.S. And even as simple as, she needs a prescription, let's say, they even advise her, you should go to Walmart instead of CVS because Walmart's charging $30 for that prescription and CVS is charging $100 for that. So even that type of advice.
Yeah.
Right? So
that'd be incredibly helpful because their system can be, ours can be difficult to navigate. Theirs can definitely be difficult to navigate for sure.
Yeah.
So I have one last question here for you. So we've heard a lot about the program, the background, kind of what you're offering. Now, for a realtor who's listening to this and thinking, maybe I should start thinking about my health right now, and what steps could I take? What advice would you give them? What would be the first step, and what can they do to kind of get started on that health journey?
Yeah, great question. Well, first thing would be to join our program, right? Because we can't help you unless you join our program. And the first step of the program starts off with an intake call. So your member our team would reach out to do an intake call. And intake call is basically a review of all the services with whoever the member is and their spouse, right? Because often it's the spouse that's handling these health types of things. To go through all the different services and also find out, do they have any concerns? Are they concerned about, let's say, cardiovascular health? Are there any issues they're facing? Are there kids? And what our nurses tell us is that 99% of the time from that first visit with our team, there's action. Like most people have something they've been ignoring, right? It could be, well, I haven't had my blood test for a few years, or it could be, I've got this bum shoulder that's been hurting me, or you know what, our son or daughter has a skin rash, or like most people have something that they've just kind of put on the back burner, right? And it's interesting because our team tells us that 99% of the time they go to work right away. Like there's something they should be solving. And then the other piece of that I would suggest that if for those that are interested in the preventative testing, all you need to do is just share with our team that you'd like to look at the preventative options out there. And I should also say a lot of those aren't even private. They can be done through the public system, right? It might take a little time, but you can, I went for genetically, I'm predisposed to heart disease. So I'm always worried about that. My dad died in the middle of the night, supposedly a fit, healthy guy of a heart attack. I've done my genetic profile, genetic testing. I'm predisposed to heart. So I need to do all heart testing. And most of it can be done right through the public system, but people just don't even know where to start, right? So we know who to go to and how to get people there is really the value.
Great. So before we go here, what is the rate that a realtor would be looking to pay for something like this? And like, what do you normally charge? And then what can we offer as a partner?
Yeah, so we have a single and a family program. So our family program typically to the marketplace is $145 per month, by the way. That gives you access to all our services. And then the only time you would pay anything additional would be if you elect private testing, right, or private options. And that includes that rate would include all children under 25 years of age, so spouse and children under 25. And so the discounted rate for GVR members is $125 a month. So reduced rate, savings of $240 a year. And there is a single rate as well for those that are single of $95 a month. And also say, because it's all of this is a health expense, it can be for those that have corporations or even self-employed, they can deduct that as an expense. And also claiming an income tax as well as a cost, as a health cost.
It's really good to know because I think a lot of our members would be in that category, right?
I would think so. Yeah.
All right. Well, thanks, Kevin. I really appreciate you coming out and talking to us about this and sharing your story with us as well, and the work that Advica is doing. I think this is an interesting program that a lot of our members would want to take advantage of. For our listeners, this partnership is about giving you practical support to help manage your health. And it goes beyond what we normally do with sales support and the MLS and that sort of thing. And it's part of a push that we're doing for these sorts of services to help you in your both personal and professional life and as members of our organization. So make sure to go to our website. It's at membernews.gvrealtors.ca, and you'll see all the information you need to see there about this program, how to sign up, and how to get started. And with that in mind, thank you for listening. I'm Mark Moldowan, and I will see you down the next critical path.